Sleep apnea is a common sleep disorder that affects millions of people. It disrupts your sleep and can lead to serious health problems if left untreated. Sleep apnea occurs when your breathing repeatedly stops and starts during sleep. This happens because of a blockage in your airway or a problem with your brain's signals that control breathing. These pauses in breathing can last for several seconds and occur many times throughout the night. Imagine trying to sleep while constantly being jolted awake. There are three main types of sleep apnea: obstructive sleep apnea, central sleep apnea, and complex sleep apnea. Obstructive sleep apnea, or OSA, is the most common type. It occurs when the muscles in the back of your throat relax too much during sleep, blocking your airway. Central sleep apnea, or CSA, is less common than OSA. It occurs when your brain fails to send proper signals to the muscles that control your breathing. Complex sleep apnea is a combination of both OSA and CSA. People with complex sleep apnea experience both airway obstructions and problems with their brain signals that control breathing. Sleep apnea can affect anyone, but certain factors increase your risk. These risk factors include obesity, neck circumference, age, family history, and lifestyle factors. Obesity is a major risk factor for sleep apnea. Excess weight, especially around the neck, can put pressure on your airway, making it more likely to collapse during sleep. Maintaining a healthy weight through diet and exercise can significantly reduce your risk of developing sleep apnea. Neck circumference is another important factor. A larger neck circumference often means there is more tissue surrounding the airway, which can contribute to airway blockage during sleep. As you age, your risk of sleep apnea increases. This is because the muscles in your throat naturally weaken with age, making them more likely to relax and obstruct your airway during sleep. Family history plays a role in sleep apnea. Lifestyle factors such as smoking and alcohol consumption can also increase your risk. Recognizing the symptoms. Is it sleep apnea? Sleep apnea often goes undiagnosed because its symptoms can be attributed to other conditions. However, being aware of the common symptoms is crucial for recognizing the signs and seeking timely medical attention. One of the most noticeable symptoms of sleep apnea is loud chronic snoring. While snoring itself is not always a cause for concern, snoring that is excessively loud and disruptive, often with choking or gasping sounds, could be a sign of sleep apnea. Another telling symptom is breathing stoppage during sleep. If your partner or bedmate has witnessed you stop breathing for short periods while sleeping, this is a serious red flag. These pauses in breathing can last for several seconds and occur multiple times throughout the night, disrupting your sleep and depriving your body of oxygen. Gasping for air during sleep is another common symptom. When your airway becomes blocked, your body struggles to get enough oxygen. This can cause you to wake up suddenly, gasping for air. Excessive daytime sleepiness is a hallmark symptom of sleep apnea. Because your sleep is constantly interrupted throughout the night, you might experience excessive daytime sleepiness, fatigue, and difficulty concentrating. Morning headaches are another common complaint among people with sleep apnea. Difficulty concentrating, irritability, and mood changes are also common experiences. Diagnosing sleep apnea. The importance of sleep studies. Diagnosing sleep apnea typically involves a combination of a physical exam, a review of your medical history, and a sleep study. Sleep studies are a crucial diagnostic tool that provide detailed information about your sleep patterns and breathing during the night. During a physical exam, your doctor will examine your nose, throat, and mouth for any abnormalities that could be contributing to your symptoms. Based on your symptoms and medical history, your doctor might recommend a sleep study. Sleep studies are typically performed at a sleep center, where you are monitored throughout the night by trained technicians. There are two main types of sleep studies: polysomnography and home sleep apnea testing. The results of your sleep study will help your doctor determine if you have sleep apnea, and if so, the severity of your condition. Treatment options. Breathing easier again. Treating sleep apnea is crucial for improving your sleep quality, reducing your risk of complications, and enhancing your overall well-being. Treatment options range from lifestyle modifications to medical devices and surgical procedures. For some individuals, making lifestyle changes can be an effective first step in managing sleep apnea. Losing weight if you are overweight or obese, quitting smoking, and limiting alcohol consumption can help reduce the severity of your symptoms. Continuous positive airway pressure, or CPAP therapy, is the most common and often the most effective treatment for sleep apnea. CPAP therapy involves wearing a mask over your nose or mouth while you sleep. The mask is connected to a machine that delivers a continuous stream of air, keeping your airway open and preventing breathing pauses throughout the night. Oral appliances are another treatment option for sleep apnea. These devices are custom fit by a dentist and worn in your mouth during sleep. They work by repositioning your jaw or tongue to keep your airway open. In some cases, surgery might be recommended to treat sleep apnea. Positional therapy involves avoiding sleeping on your back, as this position can worsen sleep apnea symptoms. Sleep apnea is a serious condition, but it is manageable with the right treatment.